Good morning, everyone. I'd like to welcome you to New Brunswick Lung NB Lung's 31st Annual Respiratory Health Symposium. Our next presenter this morning is Leah Hempel, and our original speaker was Melanie, who isn't able to be here today. So Leah Hempel will be stepping in for her. Leah comes from a background of ambulance operations, emergency management, and health policy planning. She joined NB Lung 2.5 years ago and as our manager of environmental health programs for clean air, and she handles the day-to-day work on radon. So if you happen to call our office and you're asking questions about radon, 99% of the time you're going to get Leah. So I would now like to pass it over to Leah. Thank you, Leah.
Thanks, Sarah. Okay, yes, so I am, as Sarah said, here to talk to you about radon gas and lung cancer in New Brunswick today. And if you now my slides aren't advancing. Okay. I think most of you're here today, so you do know who NB Lung is, but just in case you don't, a little bit of background. We're a provincial lung health charity, and we've been serving New Brunswick since 1933. So we're here to support patients and advocate for better public education and better health policies to the government to support like clean air that we breathe. And we're entirely independent, which means that we get a say in where our money goes. So if you donate to us, all the money stays in the province. And we expanded initially from just focusing on tuberculosis in 1933 to now we deal with a more broader range of threats to lung health, everything from smoking to vaping, communicable diseases, hereditary diseases, cancers, indoor, outdoor air quality, everything like that. We just want to see that all people will be free of lung disease. So that's what we're working towards. This is Melanie. Sorry, these are her slides. Melanie's awesome. I'm not her, but I hope that I'll be able to do this presentation justice for her. So here we go. Radon is a pretty big problem in New Brunswick. But what is it? Radon is it's a radioactive gas that occurs naturally in nature. It is everywhere. It comes from uranium in the crust of the earth, which is a common metal that's found literally everywhere on earth. It's in all rocks. It's more abundant than gold, silver, and mercury. And Canada happens to be the second highest in when we're talking about natural deposits of uranium, and we're the world's largest producer of uranium. So it is something that exists in abundance in our country. But when uranium breaks down, it releases radon gas. And as a gas, it can escape up through the ground into the air, but also into our houses. When it escapes into the air, it gets diluted very quickly, and it's not a problem. But because of the way that we build our houses to be airtight and keep everything in, because we want to stay warm, especially in winter, it creates a radon trap, and this can pose a really serious health risk to anyone living in that house. So once radon gets into your home, it doesn't stop there. It continues to decay, and that's where a lot of the problems happen. When radon decays, it releases solid particles of polonium and lead. I think as clinicians, everybody here knows how harmful lead is, but polonium's another one. It is still radioactive, and when you breathe radon, it releases those solid particles into your lungs. And lung tissue is exceptionally fragile. So even though the radiation from radon is not very strong, a piece of paper is actually enough to stop the alpha decay from radon, but our lung tissue is not as strong as a piece of paper. So when you actually breathe it in is when you start to see the problems. And because radioactive elements are unstable, they continue to decay and release more solid particles in your lungs when you breathe them in. Yeah, so this image here just shows kind of the pathway starting from radium as it decays all the way down to lead as the end product. So when you're breathing radon, you are putting lead in your lungs. And those alpha particles that you breathe in, even though it's a weak radiation, it's important to remember that it doesn't mean that it's not damaging. So alpha particles, they're genotoxic, which means they bind to our DNA and they damage the genetic information, which can cause cell mutations. And they're also clastogenic, which means that they disturb normal DNA-related processes. They can actually cause gene deletions, or they can cause duplications and insertions of entire chromosome sections. So that when we're talking about radon and radon progeny causing lung cancer, that is the mechanism by which they do that. So not only that, but as you're continuing to breathe these particles, they cause a lot of oxidative stress in your lungs. And that can also increase the inflammation and the likelihood of developing malignancies as you're continuing to be exposed. This is what it looks like. So this is an image from the inside of one of our radon detectors. And those alpha particles, the solids, when they're released by the radon decay, they dent the plastic inside of the radon detector. So if you look at it under a microscope, this is what you would see. Every mark there is a dent that has been caused by the radioactive decay of radon. And just think about that when you're imagining what might be happening in your lungs. So if you think that sounds like something that we should avoid, yeah, you're absolutely right. But what's also cool is that Canadians discovered radon. It was discovered in Montreal at McGill University in 1899, and took almost 100 years after that before the World Health Organization decided to classify it as a group 1 carcinogen. And that classification just means that it has been well studied and it has very well established links to lung cancer. So now we get to New Brunswick. In Canada, Health Canada has identified New Brunswick as having some of the highest levels. We're actually second. And this graphic here is a visualization from one of our partner organizations. It's important to understand that it's aggregated data and that it's just done by the first 3 digits of the postcode. So where you see red, it's representing an entire postcode. But we do have the second highest levels of radon in Canada. And what that means for us is that 1 in 4 homes have radon above the Health Canada guideline of 200 becquerels per cubic meter. So 25%. And just to compare that to the Canadian average is about 6.9%. So we are well above that. And there is an updated cross-Canada radon study coming out in October or early November that is going to increase those numbers as well. So we're actually closer to 1 in 3, according to the next research that'll be coming out soon. And you might have seen this map. We've got this in here because it comes from the 2012 cross-Canada radon study done by Health Canada, and it's a little bit misleading. It looked at 839 tests across the province, and they broke down the results by health region. And it can lead people living into those areas with lower percentages. It can lead you to believe, if you live there, that your region is not a problem, or that you don't have to worry about radon, because only 17% or only 10% of houses have radon there. And that's a problem, because the sample size was relatively small for the whole province. And radon, the only way to know is to test your individual house. So I put this in here just to make you aware that, if you see that map, please don't let it lead you to think that you're living in a safe area, because you really do need to test to find out. So why does New Brunswick have such high radon? A lot of it is due to our geology. As I said, like Canada, it as a country has a lot of uranium, but in New Brunswick in particular, we have a very shallow overburden, which means that you have the bedrock, and then the overburden is the layers of soil that you find above the bedrock. And in other provinces, like further out west, there can be several feet or even several meters of soil above the bedrock. In New Brunswick, it's pretty common for people to have to blast directly into the bedrock when they're building houses, because we have centimeters of soil above that rock. So because there's not a lot of material between us and the bedrock that is releasing the radon gas, it's more likely to get into our houses. And we also have a lot of particular types of rock in New Brunswick that are associated with having higher levels of uranium near the surface. So there have been studies done on radon potential and indoor radon levels that have showed an increased risk of indoor radon and increased risk of lung cancer associated with specific types of rocks. And I'll switch over to this slide. This is one of those bedrock studies. If you live above houses built on Ordovician or Silurian bedrock, which you don't need to know those terms, but that is the classification of the geological age of the rock, you are more likely to have high radon in your house. And if you live in one of those houses, your lung cancer risk goes up by about 11% for every 10 years that you spend living in those regions with that kind of geology. And even just, a small amount of radon, as much as little as 50 becquerels per cubic meter, still comes with a lung cancer risk of, 7% according to Health Canada. So that, if we expand the legend of that map, these are the colors associated with that type of bedrock. You'll see that's most of New Brunswick. What that means in more layman's terms is this is another version of the bedrock study from the Department of Natural Resources. And instead of looking at geological age, this one shows the types of rocks in names that you're more familiar with, probably like limestone and shale and granite. These are all types of rocks that are still associated with very high radon, and New Brunswick in particular is very rich in these types of rocks. So I've circled them here. These are the colors that we would expect to find the highest levels of radon in our province. And once again, it is most of the province. That kind of orangey brown color in the middle, even though I haven't circled it, it is still a type of sandstone, which is still associated with an elevated risk of radon. So when we're talking about New Brunswick geology, this is why we have so much radon. And how does it enter the home? If your house is in contact with the ground, you have radon. You might find very minimal radon in an apartment building up on the top floor, or if you have a house that's elevated on stilts, that would be unlikely to have much of a radon concentration. But in general, if your house is touching the ground, you're going to have radon in it. So it's just the way we build our houses. Even if you can't see it, there are gaps everywhere that you've put a pipe in, or when you build your foundation, there's around the outside where the vapor barrier meets the walls, there are cracks there that radon can use to enter the home. So it can come in through your slab or your sump, any pipes, and actual cracks that form with shifting foundations at the age of the building. And what's interesting as well is the more energy efficient that we make our homes, the more the radon tends to increase as well, because even though we seal the cracks and we make it more airtight so less radon can get in the first place, the radon that does still manage to get in is then trapped and it doesn't have any way to escape. So there's a lot of contributing factors to radon in a home. Even the type of bedrock that is used in the fill of the foundation. So if you live in a lower risk area, but the fill for your foundation has come from a higher risk region, you might have very high radon in your house when none of your neighbors do. So there's so many contributing factors that we really just want everyone to know that all homes need to be tested for radon, because radon is in all homes. And separate from radon, this is a map from Canadian Cancer Society that just shows general cancer prevalence across Canada, and the Atlantic provinces in general have higher rates of cancer. This was a 25-year study, so it's quite comprehensive. So we're also higher risk just in general due to whether that's due to socioeconomic factors or other demographics. Living in Atlantic Canada comes with a greater risk of cancer. So yeah, who's at risk? We all are. Lucky us. Now, radon, as we said several slides back, the World Health Organization has classified it as a class 1 carcinogen. It does cause lung cancer. It is actually the second leading cause of lung cancer in people who smoke. And if you don't smoke, it's your leading cause of lung cancer. So that means about 6 in 20 for smokers, or about 1 in 20 for non-smokers. And that's if you're exposed to, over your lifetime, 800 becquerels or more. It used to be said that the only known health effect from radon was lung cancer, but there have been a lot of studies in the last few years that are showing that all of those inflammatory responses that your body has that we mentioned earlier from radon, it can actually lead to other conditions like pulmonary fibrosis or ischemic stroke. So even though radon, the primary cause of illness from radon is lung cancer, there are other conditions that are being studied more, and especially in New Brunswick with the rates of pulmonary fibrosis that we have, radon is something that is worth looking at in those cases. So just to give some stats by the numbers here for New Brunswick, we have the most lung cancer in Canada, and lung cancer is the leading cancer in New Brunswick. Almost half of the people in New Brunswick who are diagnosed with lung cancer don't receive their diagnosis until it's stage 4. And at that point, it says here it's below 5%. The most recent figure I saw from the Canadian Cancer Council actually says that the 5-year survival for stage 4 cancer, lung cancer, is 3%. So it's even worse than what we say here. It also accounts for more deaths than all of the 4 other leading cancers combined. So prostate cancer, breast cancer, 3 cancers, and colorectal cancer. Causes the most deaths in New Brunswick. About 28% of New Brunswick cancer deaths are caused by lung cancer. So it's a very serious issue here. And it's also very expensive. It costs per lung cancer patient per year of treatment about $70,000. We averaged 802 cases of lung cancer. If you go on StatsCan website over the last 6 years and average the number of cases, about 802 cases of lung cancer in New Brunswick per year. And if each of those are costing $70,000 per year, that's $56 million that we're spending on lung cancer. And both Health Canada and the World Health Organization agree that 16% of those lung cancers can be directly attributed to radon. So by not addressing radon, we're spending $9 million on a preventable form of cancer. I hope those numbers seem serious to you, because when I read them, I was quite shocked to see that that's how much money we were spending on this. So your risk factors when it comes to radon, there's a couple things that we need to look at. Is how much radon is actually in that individual home, and how long are you being exposed to it? So the hours per day over how many years? Somebody who lives in a house with radon at 800 becquerels per cubic meter for 10 years is going to have a much greater cumulative exposure than somebody who lives in a house with radon at 2000 becquerels, but they're only there for 6 months. So it is, because it's a very low dose radiation and the effects compound over time, the length of exposure really has a lot to do with whether somebody will develop lung cancer or not. So we really need everybody to test your homes. And if you have a patient coming in with unexplained lung cancers or respiratory symptoms, please keep radon in your mind and recommend testing. It can be fixed. It's very easy to fix, and that's a whole other presentation. The main thing to know is that every house does need to be tested. So you can get test kits from us, or we don't care where you get them from. You can get them at hardware stores as well. as long as it's a long-term radon test, because you need that long-term average to get an accurate read on the levels of radon in the house. And we're always looking for help to do more. So I'm going to share a story here about a lung cancer champion that we met last year. Her name was Angela, and we met her just before her 58th birthday. She contacted us about this time last year. She was a non-smoker, very health conscious, physiotherapist. A lot of you probably know her, but she did a lot of work in the province. And she was diagnosed with stage 4 lung cancer at the end of October without having any other risk factors. When she tested her home, it maxed out the measurement instruments that the radon professional brought to her house. It was so high they couldn't actually get an accurate read. Those instruments measure up to 9,999 becquerels, so it was over 10,000. And it was mitigated. The house is now fine, but she passed away 6 months after that diagnosis. And before she did that, she gave us her permission to establish a community fund called Angela's Allies. And we use this to raise funds to bring lung cancer testing to people who can't afford, not lung cancer testing, sorry, for radon testing to people who can't afford it. With this community fund, we tested close to 1,100 homes last year, and we would really like to keep that going. So as a small organization, we're always looking for people to invest in us and help with our vision here. And we really want to help Angela see Angela's dream come true. She wanted to see every house in New Brunswick tested and mitigated. So we are trying to do that. We're doing that by raising awareness with electronic lending kits in the libraries. As I mentioned, giving long-term testing to those who can't afford it, hosting community events, and we also use the data from that testing to help advocate and create policy recommendations for the government representatives that we speak with. So if you are so inclined to help us with that mission, we would love it if you could donate to the Allies Community Fund, either by scanning this QR code or just calling us or getting on our website. Could be done there. And I think I'm running out of time. So are there any questions?
Thanks, Leah. I do have one question for you, and we have 3 minutes. So it says, our new home is roughed in for radon mitigation system. It essentially looks like a pipe coming out of the foundation. We are currently participating in the seasonal radon study. I often wonder if having the pipe roughed in increases the exposure during the time that the mitigation system is not installed. Excellent question.
That's a good question. I think it could have a small effect just because it is another pipe that has been put through your foundation, but it should be capped off quite tightly. The caps are usually glued on, so that should have a pretty solid seal around it. But I actually met somebody yesterday at a fairs expo that I was at in St. Andrews who had found, like, he had a bunch of pipes and everything in his basement, and he's completely redone everything and ripped everything out, reconcreted, resealed, and just by doing that, his radon levels halved. So it's possible, but if it was installed correctly, it should be glued to prevent any air intrusion through the pipe. But the contractors who are installing the radon rough-in pipes are not radon professionals, and they're only ticking a box that they have to tick on the build of the new home. So it should be correctly sealed, but it may not be. What that means for your radon levels, I guess, I'm doing the same seasonal study with Health Canada, so hopefully as those results come in from those tests, you'll see that you don't have a problem. But if you do, your mitigation installation will be a lot simpler having that pipe there already.
Thank you, Leah. That was very helpful and informative, and I really appreciate you stepping in for Melanie since she wasn't able to attend. It does help that Leah had helped prepare the presentation, so she definitely was on board there. We do have Melanie's contact info there, but is it okay if I give them yours as well, Leah?
Yeah,
Since Leah's
absolutely.
our on-site expert. So it's leah.hempel@nblung.ca. If you have further questions, you can call our office. And as she said, you can purchase radon kits online, or you can get them from us at the office. So thank you very much for being here with us this morning, Leah. We
Thank you.
appreciate it. And thank you, everybody, for standing by as we had some little glitches today.